Welcome to MyPatchLink.com's video series on allergic contact dermatitis. In this short video, you will learn about contact dermatitis, its symptoms, and how to manage it.
Hi, my name is Dr. Matthew Zyrus, and I'm going to teach you about allergic contact dermatitis, otherwise known as ACD. The results of your patch testing show that you have ACD. It's different than regular allergies to things like bee stings, penicillin, or hay fever from pollen. It occurs when your immune system starts to react to a chemical that is in a product or object that you may use at home or at work or almost anywhere. Symptoms of ACD usually include severe itching, flaking or cracking skin, redness or a rash, or even swelling or fluid-filled blisters. These symptoms start anywhere from hours to days after touching or using something you react to, even if you only use or touch it once for a few minutes. And they may last for weeks or months, even if you don't touch or use it again. It's very important to remember that ACD can be caused not just by things you use daily, but also by things you use just once in a while, even things you use just once a month. Examples of things that cause ACD are personal care products such as shampoos and cosmetics, metals and jewelry, sports equipment, and many, many other things. Fortunately, your patch test results will help pinpoint what things are causing it in you. Again, ACD develops when your immune system starts to react against something coming into contact with your skin. Now, everyone is born with an immune system that has the potential to react against these substances after a certain amount of exposure. At some point, you had enough cumulative exposure or exposure in the right way so that your immune system started to react. And this can happen at any age, so that contact dermatitis can start in babies under 1 year old or in people over 100 years old. The point is that once your immune system starts to react, it will always react when exposed to the substance. Another big thing to keep in mind is that just because you didn't react to something in the past doesn't mean that you aren't reacting to it now. So I often hear patients say, I was using this product for a long time before the rash started, so it couldn't be causing the rash. This couldn't be more wrong. The longer you use a product, the more chances your immune system has to learn to recognize it, and so the more likely your immune system will start to react to it. So instead of just thinking about what products are new since the rash started, you should also be thinking about products that you've been using for a long time. Now, to pinpoint the specific substance that is causing your symptoms, a patch test is usually required, since it is the only way to find out what your immune system is reacting against. Then, once we know what substances are causing your symptoms, you can begin avoiding them. It's important to remember that a specific substance or ingredient may be found in many different products or items. For example, some ingredients are found in almost all shampoos. So even if you've used 5, 6, 7 different shampoos since your rash started and you've not gotten any better, all the shampoos might have had that same ingredient in them. And so if you're allergic to that ingredient, you wouldn't start getting any better until you started using a shampoo that didn't have it. So if you want to get better, you need to avoid all products and objects that have the substances that you're reacting against. Even once you've started avoiding the specific chemical allergen, it may take months for your skin to fully heal. And unfortunately, in some cases, it's almost impossible to completely avoid a substance. And in these cases, the skin may get much better, but may not get completely better on its own. And so your doctor may prescribe medications to help with the healing process. Again, remember, once your skin is better, if you come in contact with the substance that caused your ACD, it can cause a setback in your skin's healing, and the symptoms can all come back. It's going to be this way for the rest of your life. You'll always need to avoid the substance, but there are things you can do to manage your allergy. Number one, Know the names of the substances you react against and where they may be found. Number 2, learn to avoid them or to protect your skin from direct contact with them. Number 3, learn if there are other related substances that may also cause problems and avoid them too. Number 4, if the substance is an ingredient in products, read labels to find products that don't have it. Number 5, it often helps to use the internet to look for products that don't have the substance you react against. Number 6, it may be helpful to tell your physician, dentist, and maybe even your hairdresser what substances you react against. And number 7, if you must use or contact the substance, protect your skin by putting a protective layer between you and the substance. Coat the surface of the object or wear protective gloves and clothing, and minimize how long your skin is in contact with the substance. Now, I know I've given you a lot of information about ACD and you're probably feeling overwhelmed right now. But remember, it's good news that the cause of your rash has finally been figured out, and now you know what you need to do. It is manageable, and there are many resources out there to help you learn how. Thank you, and I wish you success in managing your contact dermatitis.
As with all medical conditions, if you believe you are suffering from allergic contact dermatitis, please contact your healthcare provider. Additional resources and information are available to you at mypatchlink.com/resources.